Thank you for joining us. And I'd like to introduce our speaker. So we have Dr. Francesca P. Is a DBT Linehan board certified clinician and an associate professor of psychiatry at the University of Massachusetts Medical School. She's the founding director of the Youth Dialectical Behavioral Therapy Program that focuses on the treatment of children, adolescents, and young adults within the DBT model.
Thank you so much. It's an honor and a privilege, as usual, to be here. And as Carol said, this is not my first time. And it's always a wonderful and warm welcome. And I'm very, very excited to be here again. Now, as Carol said, my main interest, at least right now, is not only teaching, not only doing research, but training other clinicians, training parents in DBT for children. And I'm going to talk about some of DBT for children today as an introduction to the model, but the topic of today's presentation is more about how DBT for children helps to help the client, the identified client, and helps to help the families, but from the perspective of how do we actually engage the siblings? What do we do to help the sibling survive a lot of the time huge emotional dysregulation that is ongoing in a household? And we cannot let them behind, number one, for themselves, and number two, because their regulation, their ability to help also can yield a lot of positive results for the therapeutic gain of the so-called identified client. So don't forget the other one. Don't forget the sibling, right? Don't forget the other child. I'm going to start with giving you a very brief overview of what DBTC is, the components of DBTC. And I'm going to start with the dialectics. Of course, DBT stands for dialectical behavioral therapy. And dialectics means that everything has two sides. And these sides are not the same. They're complementary. Day, night, yin, yang, life, death, good, bad, right? Complementary. Our information field, right? Our existence also is dialectical, consisting of conditional side of the existence and unconditional side of the existence. In a conditional side of the existence, we're dealing with external controlling factors, what other people are doing, all the stressors coming our way, and how we're dealing with those stressors. Meaning that if a stressor is coming in and I have a big emotional reaction and I cut myself, and what we're teaching, instead of cutting yourself, use a skill, right? The stress tolerance, emotional regulation, whatever it may be. Now, there's another side to this called internal controlling factors. Now, if external controlling factors is my relationship with the external world and other people and the stressors that are coming from the external world, internal controlling factors is my relationship with me. Now, on the external controlling factors, we have factors that elicit, reinforce, punish, extinguish, shape our responses. On the internal controlling factors, we have our relationship with self that can be detailed in terms of the vulnerabilities in the three core senses: self-love, safety, and belonging. And if you think about it, when we talk about our responses, such as screaming, yelling, trying to control other people, suicidality, self-harm, drug, alcohol use, these responses are not problems. They are solutions to problems. They become issues on their own right, but they start as solutions to problems. If I'm anxious, I'm going to drink, my anxiety is going to come down, right? If I have a big emotional dysregulation moment, I'm in emotional suffering, I cut myself, my emotions subside. On the other side, what are the problems where those symptoms are coming from? That's my relationship with me. If I hate myself, of course I'm going to self-harm. Of course I'm going to self-punish. I'm going to be self-critical. I'll impose on myself. If I cannot control the only thing I can in this life, me, what I do, what I feel, what I think, my biology. We can't control other people. We can't control life and circumstances. We can only be in somewhat control of ourselves. If I cannot even control myself, I will get an illusion of control. I will try to get the illusion of control because our sense of safety demands control and predictability to decrease that vulnerability. And the illusion of control comes from what? Trying to force other people. Don't stand there. Don't say that. If only you gave me what I wanted, I would have not had that reaction. Or trying to force yourself, right? And use all kind of maladaptive solutions. If I don't even belong with my own family, if I don't belong with myself, if I don't give to myself, how can I give to other people? And forming and maintaining healthy relationship only comes from giving. But if I didn't give to myself, they have nothing else to give to other people, right? So again, when we talk about external controlling factors, this is the level of the symptom. Internal controlling factors, a level of the problem. Here is my relationship with the environment. There is my relationship with self. When we talk about DBT standard model and DBT for adolescents, they are primarily targeting external controlling factors. Now, internal controlling factors is targeted by an assessment and intervention model that's called core problem analysis that I have developed, that not only useful for children, it's adults, adolescents, doesn't really matter whether or not you have psychiatric conditions, whether or not you have issues in life that are on a clinical level. Every single person sustained complex trauma. What is complex trauma? Relational trauma, being harmfully invalidated, criticized, blamed, shamed, downward comparison, threatened. All of that is damaging my relationship with me. We all have complex trauma. Everybody needs to improve their relationship with themselves. And core problem analysis is an assessment model that actually identifies factors that causes vulnerability in our three core senses and provides additional intervention on how to decrease those vulnerabilities in a healthy way. And all of that is DBT for children. So DBT for children brings two sides of what we're targeting: my relationship with other people and my relationship with me. Who are we targeting in DBTC? Well, we're targeting emotionally sensitive children. And how do we know what is emotional sensitivity? It's low threshold, like somebody did not look at me right? When something is triggers, reaction goes from 0 to 100 in a split second. Slow return to baseline. Could be not just minutes, could be hours before the person goes back to being more or less regulated. And of course, when you have such emotional sensitivity and such reactivity, you're going to have corresponding behavioral discontrol, frequent temper outbursts, physical, verbal aggression, sometimes all the way to suicidality and non-suicidal self-injury. Now, everything has two sides, including emotional sensitivity. What we talked about were challenges, but there are also advantages. We have a lot of research demonstrating that emotional sensitivity also leads to enhanced experience of positive emotion, not just negative. When these children get happy, sometimes they go that as happy, they become silly, right? Also, their emotional apparatus, right? They're so sensitive not only to their own emotions, but also to emotions of other people. They're able to read other people and the changes in their emotions, the climate in the room and within each and every person so much more readily than people with average emotionality. And they're like human x-ray. Now, they may misinterpret what they're reading, but they're not going to miss it. Also, they have enhanced empathy. In between outbursts, of course, during the outburst, all bets are off. We call it prehistoric monkey comes out and tries to claim control, screaming, yelling, trying to force other people in circumstances to be just like this. In between those outbursts, they're very caring, they're very understanding, they're very empathic to other people. They know what suffering feels like, and they can sense other people's emotions so much better, which promotes empathy. And there is a lot of research linking enhanced, emotionality to increasing creativity. These children, adults, adolescents, are usually very creative because they have a different brain, so to speak. That's why a lot of the time emotional sensitivity is also associated with learning differences, with low maturation of the frontal cortex, with ADHD, right? So they have a different brain. And what is creativity? Creativity is thinking outside the box. They are born thinking outside the box. That's why they can be more creative. So when we think about it, emotional sensitivity is a special ability that a person has. And it's not a problem to correct. Number one, we can't correct it, right? You're always going to be emotionally sensitive if you're born this way, right? But what we're here to do is we're here to give people who are very emotionally sensitive muscles, right? To be able to withstand this emotional tsunami that's overcoming them so that they can do this to the emotional tsunami, right? Emotional regulation muscles, distress tolerance muscles, mindfulness muscles, so that they indeed can withstand the challenges and benefit from all of the gifts that emotional sensitivity brings. Now, very important to understand that emotional sensitivity does not equal emotional dysregulation. Emotional dysregulation is a product of emotional sensitivity and the environment not being able to meet the needs of the emotionally sensitive child because they come in with more needs. And you see, there is, families coming in with several children, and two of the other kids are absolutely fine. This one is climbing walls and doing cartwheels and all kind of things are happening, right? And parents are coming in and saying, oh my God, they're sucking all of the life out of my family. I just cannot take it anymore. I cannot tolerate it anymore. What is going on? Because the other two kids, parents, and most of the parents that I see are wonderful, great, capable parents. They are, good enough. But the thing is that they're good enough for children who are more resilient. The good enough parenting is just simply not good enough for emotionally sensitive people. So this child who's coming in with more needs is starting to impact the environment. Environment does not understand. Why are you reacting this way? Why are you angry? You're not supposed to be angry. Why can't you be like your brother? Harmfully invalidating, simply from misunderstanding. What is validation? Validation, something makes sense to me, given the cause. I understand why you're so upset because your brother broke your favorite toy, right? I'm not condoning you, being aggressive towards your brother because you were upset, but I am validating the cause, the reason why you became upset, right? Invalidation means something doesn't make sense, right? And when we are just, pervasively invalidating our supersensor just because we don't get it, and why would we get it if we're not ourselves emotionally sensitive, or why when something actually occurred, you missed it because it doesn't take much to provoke such big emotional reaction in our supersensors. And they keep getting invalidated. And also parents don't know, even if they understand what's going on, they may not know what to do and how to help the child and how to give them the skills that they need to use. Because we're not born with instructions. Those parents don't know how to help that extra sensitive child. So then you have this child impacting the environment. Environment doesn't know what to do with that, gets dysregulated, impacts on the child, dysregulate the child more, and more dysregulated child impacts the environment. And here we have a transaction that leads to two products: emotional dysregulation and invalidating environment. It doesn't start with invalidating environment. Most environments are, good enough, healthy, good enough parenting. There are some environments, of course, that are a priori abusive and neglectful, but most, no, absolutely not. It becomes invalidating through that transaction because the parents are not able to understand why it's happening and don't know what to do with it. And therefore they criticize, they judge, they blame. And a lot of the time, it's not done to harm the child, absolutely not. And a lot of the things that parents are doing, maybe with best intentions in mind, unfortunately backfires. So good enough parenting is just not good enough for our super sensors. They need super parents. And when we talk about super parents, we're talking about the premise of the entire model. DBTC is about parents. It's parents' first approach. What we're doing, we're helping parents to become the programmer for their child, to become the coach, to become the therapist, whatever you want to call it. And there are times when families come in and child does not want to participate. All I need is one parent, not even two parents who are willing to do this is a luxury. I need one parent who knows what they're getting themselves into and actually willing to do this. Two parents is a luxury. A child on top of that who is willing to do this and not just sitting there and say, I don't know, I don't care, a luxury upon luxury. It would be, of course, much faster and much easier if everybody got involved and everybody were doing things and techniques consistently. However, for change to occur, we need parents, or at least one parent, to learn what to do and how to parent their child. That's what we're there for. How do we describe super parenting to our parents? I use a metaphor. We use a lot of metaphors in dialectical behavioral therapy. I say super parenting is like being a firefighter. Number one, firefighters do not start the fires. What does it mean in parenting terms? Avoid modeling verbal and physical, aggression, avoid retaliation, avoid harmful invalidation, criticism, judgment, shaming, blaming. On the other hand, the dialectic, on one hand, don't start the fire. On the other hand, they're not afraid of the fires, which can be in parenting terms like accommodation, tiptoeing around the child being afraid to ask them or to prompt them or to help, tell them to do homework, because parents know what's going to follow is a big outburst that's going to last for hours and nobody wants to be part of that, which is absolutely understandable. As I said, parents actually saying it, this child is sucking all the life out of the family. So it's understandable validation point why parents may want to accommodate. But accommodation is absolutely toxic. Number one, it's telling the child. It's not telling the child what to do instead. It's not giving the child an environment that is supportive, where they can hold and contain the child, in a loving and accepting environment where they can actually learn alternative responses. Outside environment is not going to validate the child, right? And parents are not teaching them anything else. Therefore, the child is likely to fail. But if when you go deeper, accommodation signals to the child, I am not in control. I don't know what to do with you. I'm afraid of you. You are a monster. And you know what? When I talk to these children and when they're comfortable to discuss this is exactly the word that they're using. They are actually telling me, my parents think that I'm a monster. What to do instead, right? The synthesis. Calmly and skillfully putting down the fires and preventing fires in the future. Learning all kinds of techniques. This is just a subcategory. Validation, prompting, reinforcing adaptive behavior, using effective parenting techniques outside of the ones that I already mentioned, daily reinforced practice of the skills with the child, working on parental own emotional regulation. This is what it means to be a super parent. Now, super parenting is not just for the super sensor. Once you learn to become a super parent, you will, of course, be a super parent to all of your children. And you need to be, because those siblings are suffering through all of the ups and downs of the unpredictability of what is happening. Now, emotional sensitivity is very interesting with emotional dysregulation, right? Is this volatility that is up and down, like EKG, right? at any point the child can explode, and the next second they're fine, most caring, most fun to be around, right? And this unpredictability, this up and down, causes a lot of stress. There has actually been research done that was published in 2024 by a Norwegian team on children of parents with children with disruptive mood dysregulation disorder, our supersensors, and they compared the parental stress of parents with children with DMDD, disruptive mood dysregulation disorder, with parents with children with other very serious psychiatric conditions, depression, anxiety, ADHD, Tourette's, right? And what they found was that the stress level of parents with children with DMDD was significantly higher than the stress of the parents with children with other severe psychiatric disorders. One of the explanations for that, which is, of course, comes to mind almost immediately, is that the other psychiatric disorders is what can be called inevitable pain. They don't come out of their depression for 25 minutes and then go back, and they don't stop being ADHD for a day. They're always anxious. So this is predictable. This is inevitable. As we said, the children with DMDD, like EKG, up and down, up and down, up and down, up and down. You never know where the shoe is going to fall, so to speak, right? And that is very threatening for our sense of safety, because our sense of safety demands predictability, demands control, demands sameness. That's why stress is so much increased, but not only for parents, also for siblings. So on top of being victimized a lot of the time by emotionally dysregulated, supersensors, being subject to verbal and physical aggression, right? They also have to also withstand the increase in their own stress response, because they never know when their sibling is going to be nice, and when their sibling, again, going to be like, this prehistoric monkey come out and wants that control and wants to dominate and wants to force. Also, because there's so much attention is paid to the supersensor who is emotionally dysregulated, siblings may not just get similar amount of attention from parents, because parents are stretched 100%, right? As we said, their sense of safety is highly threatened, right? A lot of the time, they also put by parents in a position to accommodate by saying, okay, just don't provoke. Okay, when he does this, just don't ask him. Don't do this. Just give him the toy, right? And they can be also harmful and invalidated by parents, because parents are criticizing the siblings for saying something wrong or doing something wrong that provoked another outburst. Now, what are siblings learning through all of this? Outside of being victimized, outside of them themselves developing complex trauma, and sometimes all the way to PTSD, what they're learning is, what? If I want attention from my parents, I need to engage in some sort of problematic behaviors, because it did work for my brother or my sister. Also, my brother and my sister are using force to solve problems. And you know what? Sometimes it does work. Also, through all of the invalidation that comes from their parents' criticism and judgment, they learn to self-invalidate and self-criticize. Now, there is a category of siblings that may develop an issue, right, with contributing to the problem. They may also start retaliating. They may provoke the supersensor back. They may pay attention to the problematic behavior, right? And therefore, as soon as you pay attention to the problematic behavior, you're reinforcing that behavior. They start to use force back, verbal and sometimes physical aggression, to solve problems. All kind of sibling rivalry and continuous conflict, which is further stretching the emotional capacity of their parents and exacerbating parental stress, making them less and less capable of effectively parenting and solving problems. The result of that is, of course, high level of dysregulation in the entire household, and siblings themselves can develop a clinical level of psychological disorders, anxiety, depression, also behavioral problems. Now, some siblings can actually develop what's called a perfect child syndrome. They're trying to stay away from conflicts. They're trying not to put any stress on the parents. They're trying to be A students to get some sort of praise from their parents, right? They use over control, right? And attempting to be on their best behavior as much as possible, avoid interacting with the supersensor, and even avoid asking for parental attention. What is the result? Similar things. Sooner or later, when you're using over control to that degree, is it because previously what we talked about was under control, sibling fighting back, retaliating. Over control, sooner or later, even though those children seemingly on the outside are doing okay, no, they're not. They are also at a very high risk of developing anxiety, depression, and other internalizing problems, either concurrently or a lot of the time also later in life. Also, we see this all the time. When supersensor, who is emotional dysregulation, improves, what happens at that moment, the sibling, this perfect sibling, had not given parents any problem, all of a sudden starts to act up. Why? What just happened? Well, because the homeostasis used to be what? Emotional dysregulation, emotional dysregulation, emotional dysregulation. Nobody likes it. However, everybody is comfortable in predictability of what is happening, the predictability of unpredictability and chaos. So living in chaos is comfortable because that's what they're used to. So when everything starts to mellow down and chaos goes, as much down as possible, and there's some restoration of order, what happens that siblings may start to act up to get everybody back to what was predictable and comfortable before the chaos in the family. Also, parental attention is freed up, and they have learned that problematic responses result in parental attention, and they're going to use it up. Now, what do we do with all of this within the DBTC model? How do we help the siblings? Before we get to the specifics, let's talk about parenting and what parenting is all about. Number one, parenting is strategic, not tactical. Meaning what? Tactics is getting something that's short-term, a lot of the time at the expense of long-term. Strategic, a lot of the time, going through pain and having to pay for it in the short term so that you can get dividends in the long term. It's kind of like winning the war as you're continuing to lose some battles. Let's take ignoring. Child is screaming and yelling, and parents are accommodating, pacifying, giving the child what they want. Child came down, everybody had a nice evening. What just happened? Tactical win, horrible strategic loss because child learned, oh, freaking out does work for me to get what I want, meaning that we just reinforce that behavior for the future. The other way around, child is freaking out. Parents are doing what we call three monkeys. I don't see you, I don't hear you, I don't talk to you. As you're freaking out, right? As you're having the emotional dysregulation moment. And usually what happens is when you're not getting attention, you're getting an escalation in the behavior. We call it extinction burst, right? Child learned that before they would get attention for this. And now nobody's paying attention. What happened? Maybe I need to do more of it. Maybe now I need to throw curses or call my parents names or scratch the grand piano, right? And parents continue to ignore. Terrible 5 hours of screaming, tactical loss. Nobody had a good time that evening. Beautiful strategic win. And if you continue to ignore, sooner or later, that behavior is going to extinguish, as we know by the behavioral principles. So strategizing is about the entire family, not just the identified client. It's about strategizing with the siblings as well. What are we here to do, right? We are here to help parents parent between problematic situations. A lot of the time, parents start to parent and pay attention and do something when something is already happening too late. We need to parent before what already is happening is the result of the parenting. And whatever is already happening, there are 3 scenarios and 3 things that we do. It's very simple. I like it. I want for that to happen in the future. I reinforce it with attention, points, praise, rewards. I don't treat it as a should. My child should be following directions right away. My child should be polite, right? No, you want your child to follow directions right away? In the future, acknowledge it, reinforce it, praise it. So I like it, I reinforce it. I don't like it, and it's safe, meaning there is no physical aggression or destruction of property, I ignore it. 5 hours of a temper tantrum, I ignore it. In the car, are we there yet? Are we there yet? I ignore it. Cursing, screaming. All of that is very taxing emotionally, but safe. If it's safe, the most effective thing you can do is ignore. And of course, we do plan ignoring, and we follow it with, processing and helping the child learn what to do instead. But this is like, I'm not going to get into the nitty-gritty of the techniques. So I like it, I reinforce. I don't like it, I ignore. It's unsafe, physical aggression, destruction of property. I use mild punishment techniques such as timeout, for example, right? Now, I didn't say validate. I didn't say teach skills. I didn't say model anything. No, all of this validation, teaching skills, modeling, practice, reinforce, all of that is happening in between. Parenting happens in between. If I can reinforce my child, I can say to myself, oh my goodness, I contributed to this wonderful, glorious moment that I can actually say, oh my goodness, great job, you, right? So happy you did that. If I had to ignore my child, or God forbid, punish my child, I need to say, oh, all right. What did I do in the past to actually bring this about? And what do I need to do differently next time? But we talk about parents first. I parent. What do I need to do differently? This is not about my child. My child is my product, biologically and environmentally, which is a statement of hope. If your child was not programmed in a way that you would want for your child to respond, it's in your hands to reprogram your child, because you are foundational programmer. This is a biological computer, right? With its memory banks and processors, and and every time we teach something to our child, we are writing programs in the child's software. So you can, of course, reprogram your child. You are foundational programmer, and you are unquestionable authority. I'm not going to go into that, but please believe that the you being unquestionable authority is something that's pre-programmed into the child hardware. We come here with hardware. We don't come here tabula rasa, blank slate. We come already pre-programmed with our learning differences and talents and predispositions to physiological disorders, psychological, including all kind of instincts like instinct of self-preservation, and treating your parent as unquestionable authority. There are all kind of studies done on that. So on the level of consciousness, if you say to your child, you're so stupid, your child can say, you're stupid, and send you to hell. Below the waterline of our psychological iceberg, right, where our software lives, where our hardware lives, my mom or my dad said I'm stupid, I am stupid. Even though on the level of consciousness, they dismissed it and sent you to hell. You have to be very careful what you say to your children. We have to be very much aware of that we are indeed those unquestionable authority and main programmers for our children, and everything has two sides. It's a huge responsibility, and we indeed can do things that can cause, trauma to our children, like complex trauma, and sometimes all the way to PTSD, and program them in a way that you don't actually want your child to, behave this way or respond in that way. But the other side, because you're unquestionable authority, nobody else in this world has an impact on your child as much as you do. Not me, not teachers, not peers. What are we teaching? We're teaching our parents to become protectors to their children. There are 4 types of parenting. Effective parenting style is parent protector, right? Ineffective parenting style is parent friend. Sometimes parents want to be friends to their children. Number one, you cannot be a friend to your child. It's an illusion, and children have their own friends, and you're losing the protective ability because you're on the same level. But most of the time, when we have children who are emotionally dysregulated and the environment already became invalidating, what we see is even lower than that. The levels of parent servant, that's accommodation, and parent perpetrator, that's harmful and traumatic invalidation. And most of the time, what we get is, unfortunately, parents are put in a position to vacillate between forcing their children, trying to obtain control, criticism, judgment, screaming, yelling, to just get some semblance of control and peace and quiet. But you can't continue to force all the time. At some point, you have to let go, and you go right to accommodation. And you accommodate, but at some point you want the control back to harmful, traumatic invalidation, back and forth. What kind of emotional regulation can occur for the child? That's why I tell parents, I cannot regulate a child in dysregulated environment. And unfortunately, that exactly what happens when this transaction between emotionally sensitive child and parents just don't know, and they're not supposed to know. We're not born with that knowledge, right? Don't know how to help that child, right? And the product becomes this invalidating environment. This is just another way of describe what it looks like vacillating back and forth between accommodation and harmful and traumatic invalidation. Now, to become a protector, right? Like if you're, for example, bodyguard to somebody, you need to know what to do, right? You also need to have a capacity to do it. Also, you cannot be afraid of a person that you're protecting. Ding, ding, accommodation. That means you're afraid of your child. And you cannot make the child, the person that you're protecting, afraid of you. It's not going to work. So, learning how to become a protector, learning all of those techniques, figuring out how to not only improve relationship with your child, but also improve your relationship with you. Right? Gaining the capacity to apply all of those skills, decreasing accommodation, decreasing any kind of prolonged inappropriate punishment, screaming, yelling, harmful invalidation. All of these things that we do, we call them seeding. Parents are modeling what they want their child to do, not modeling what they don't want their child to do. Parents are teaching. Parents are practicing skills with the child. Parents are reinforcing and shaping, right? And ignoring maladaptive behaviors. All of that is seeding. For germination to occur, meaning the flowers of change, we need to have 2 things. Everything comes in 2, dialectic, right? We need to have seeds, but we also need to have a ripe soil. Now, when the child will be able to take all of that knowledge, nobody knows. Nobody can predict that. The child is not in control of that. I am not, parents are not, right? So parents can only do what they can do, what they can be in control of. They're not in control of when their child's soil, so to speak, will become right, so that germination can occur from all the seeds they're depositing. They can only do what they can control. The only thing that they can control, themselves. Meaning, as you're doing all of those wonderful modeling and teaching and practices, you're not attached to the outcome of when and how the change is going to happen. Attachment to outcome is one of the biggest problems that we have, because people start to do what they need to do, and then the child is not changing, and they say, okay, it's not working, and they're done. No, what we have, we did not do enough of quantity to achieve that qualitative jump. If you know exactly what why your child is doing what they're doing, if you know that the intervention is matching the function of why the child is doing this maladaptive behavior, keep doing the intervention. Child behavior becomes irrelevant. Sooner or later, the change will come. But for you to get to that sooner or later and have the patience for it, non-attachment to outcome, which is extremely important for any kind of problem solving, because we don't control actually much in this life. We don't control life, people, circumstances, right? Attachment to outcome means that we are painting a picture in our mind of how things should be, and then we take that picture and we're imposing on external reality, and that external reality does not match our picture, and then we get disappointed and we are dropping the ball, right? Be that with parenting, be that with any other attachments to outcome when we're trying to problem solve. Now, parent protector for the sibling. So we're going to talk about all of those 10 aspects that we actually want to include in helping the sibling to get through that period of time as the supersensor who is emotionally dysregulated is actually recovering and is gaining those, getting those therapeutic gains. Number one, orient. Educate the sibling of your supersensor about what is going on, that their sibling is emotionally sensitive. Talk about the challenges and the benefits that we talked about at the beginning of the lecture, right? Help the child understand that the sibling is doing the best they can. And the dialectic, of course, needs to do better and try harder, right? Also, help your children understand exactly the thing that I've been saying over and over again. We cannot control other people. Neither I nor you can control your brother or sister. The only thing that we can do, we can directly influence ourselves so that we can indirectly influence the behavior of other people. By the way, ignoring is a very good example of that. My child is screaming. What do I want to do? I want to scream back. That's normal response, right? Instead, I'm directly influencing myself and I'm ignoring. I don't see you, I don't hear you, I don't talk to you. I'm directly influencing myself. I didn't even look at the child. I didn't even say anything. And my child is changing their behavior. Usually at the beginning, they're going to get worse. We call it extinction burst, right? The behavior is changed, right? I didn't do anything. There was an indirect influence. Yes, not in a direction that you want, but the direction that you want will follow if you continue to do it consistently. This is what we call indirect influence. Anytime we try to directly influence other people, it's force. What we are teaching siblings and what we need to do and we need to model is this stance. If I don't like how other people relate to me, instead of me trying to force other people to do things differently, it's not going to work. We all know it. We see so much empirical evidence of that. And we still keep doing the same thing, expecting different results. Instead of engaging in this insanity by the definition of Albert Einstein, we need to stop ourselves and ask ourselves a question. What do I need to do differently in order for that person to relate differently to me in the way that I want them to relate? Starting with yourself. Finger on me. Always, be that a parent or be that a child. This is what's called internal locus of control. Also, help the siblings understand, and not only about their dysregulated, supersensor brother or sister, but anybody else in their life. If they want to maintain healthy relationships, what we need to do is give. That's the only way that we can maintain healthy relationships, by giving. But in order for us to give, we first need to give to ourselves. We'll talk about this in a couple of minutes. Validate the siblings' distress. Don't just criticize and judge and expect them to do differently and, without, learning even what to do and impose on them being responsible for the siblings' regulation. No, validate. I understand why you're so upset with your brother. Of course, how else can it be? He was screaming at you. He was trying to provoke you. He touched all of your things. He broke your favorite toy, whatever it may be. Validation goes a very long way. If one of the siblings, let's say the supersensor who is emotionally dysregulated and having a temper outburst, turn to the sibling and help the sibling to ignore. That's another thing that you need to teach them, to ignore, the emotional dysregulation moment, and validate them in that moment and say, hey, totally understand. This is very hard. It's hard for me. It's hard for you. Remember, we're going to continue to ignore it here, right? And this is the most caring thing that we can do for your brother and sister. So I'm not going to go into all of the functions of validation, but please remember that validation is a foundation for change. For us to be able to get to change, we first need to accept. And validation is this magic wand that is indeed helps the person feel I'm not alone. I'm understood. My suffering have just been, there's a kernel of truth in my suffering that other people see. I don't need to prove to anybody that I'm suffering. It's being seen, it's being understood. Unhooking them to actually seeing what can be done differently next time. Do not make the sibling responsible for keeping the supersensor stable. Because that is also, number one, they are not responsible for that. They're not supposed to accommodate. And that also teaches external locus of control, meaning that other people are responsible for how we feel, what we do, and what we think. That's exactly why emotionally dysregulated supersensors try to use force, because they're making other people responsible for their suffering instead of understanding, wait a second, no, it's my responsibility to control what I do, what I feel, what I think in my biology. Nobody can do it for me. Internal locus of control, right? Helping them understand that we cannot control other people. We are not responsible for other people's reactions. We are not. When something is happening, it is subjectively neutral. Objectively, it's both. Can be like two sides to it. Can be good and bad, right? But subjectively, it's neutral. Because however many people just looked at what just happened, that's how many interpretations they have made about it. And then we provoke ourselves with our own interpretations. Nobody can provoke you. That's why if you change the way you think, you change the products of thoughts. Your feelings and your actions are products of thoughts, right? So change the way you think. Don't make other people responsible. If other people were indeed responsible for the way we react, then we have no control whatsoever in this life. Now, that would be really scary. No, we do, of ourselves. So instead, empower children, be that a supersensor or the sibling, by teaching and modeling what to do and how to tackle, how to deal with challenging behaviors, right? And supersensor and the siblings, both parties, need to learn that they can only control themselves and they're responsible for their own reactions, right? And this is what's teaching the internal locus of control. Teach and reinforce coping skills. Now, when a supersensor may indeed need to learn and practice the whole curriculum of skills, but siblings may only need several, like teach them 3, 4, 5, and then overlearn the techniques. If you tell the sibling, don't do this, don't do that, that's only telling the child what not to do. It's not helping the child to understand what to do instead, and does not give the child the capacity to do it. Teach and then practice. Like we are asking parents of supersensors to practice skills on a daily basis, what we call in pretend mode. Let's pretend your brother or your sister comes into the room and touches all of your stuff to get a rise out of you. What are you going to do? You're going to do your pace breathing, or you're going to turn around and walk away. Fantastic. And then you role play it. You actually become the brother or sister, and you actually pretend to touch all the stuff. And then the child is engaging in the practice of that skill. What you're doing, you're helping your child write a program into their software to override the another program that has been coded and recoded many times, could be for years, could be on a daily basis, very strong program. I'm upset, I freak out. We need to override it with, I'm upset, I use a skill. Be that a super sensor, be that their sibling. It doesn't really matter. They need to know how to ignore. They need to know how to walk away. And the orientation to the super sensor and to the siblings, I always recommend, for parents to orient the entire family, not just the super sensor, about ignoring. And what I'm going to say is absolutely true. What we say in orienting is this: hey, there are times when our emotion mind gets so strong that pushes right into the emotion ocean, right? And the most caring thing that I can do for you in this moment is to patiently wait until you calm down and we can discuss what to do in a wise mind. Everything I said is true. I am patiently waiting, and it is the most caring thing that I can do, regardless of whether the child actually doesn't like being ignored. Nobody likes being ignored, and even escalates in that moment and tells you, oh, I don't like when you're ignoring me. I know that. And it's still, again, two things being true at the same time. Paradox is the only, norm of our existence. It's ignoring is not something that people like. They get, even more upset. And it's the most caring thing that we can do for them. We're not reinforcing that behavior, and we're putting them in a position to figure out what to do differently next time. Because change is very hard, extremely hard. And it's even harder for emotionally sensitive people, because they not only need to withstand the impact of the challenge, they need to withstand the huge emotional tsunami that they have corresponding to that challenge, right? We call it walking in double gravity. So for them, challenge is even more tricky. And why would they change if it works for them, right? So that's why we need to put them in a position showing, no, you're not going to get attention for that behavior. And attention is currency. Children crave parental attention. That's another thing that's pre-programmed into their hardware, because that's a survival method. And you can use that attention, and you can buy with it more disruptive behaviors, or you can buy with it more, functional behaviors. It's the same currency. Whatever you're paying attention to, that's what you're buying for the future. Now, with siblings, it's similar in terms of they're also providing attention. They're also teaching, the super sensor, oh, that works. If I do that, my sibling gives me attention, or gives me what I want, or gets provoked. And if I'm miserable, I want to make him miserable, and it actually works. None of that needs to happen. So when siblings ignore each other, turn around, walk away, for example, this is the most caring thing that they can do for each other, right? And we're teaching them the 3 monkeys, and we're practicing them. And to ignore effectively, ignoring is actually a very active process, right? As you're just sitting, not looking, not talking to the child, in your mind, lots of things are happening. Number one, you may actually be using an emotional regulation technique, such as pace breathing, right? You may be validating yourself and saying, oh, okay, I understand why I'm so upset. This is very, very hard. Who wouldn't be upset in this situation, right? He's screaming and screaming and screaming. Validation, by the way, is an emotional regulation technique. It does decrease emotional arousal. You may be validating your child in your mind, not out loud, because that's attention. During the outburst, no validation, either before or after, during processing, not during. Its attention in your mind. Instead of criticizing your child and saying, oh my God, I cannot believe this, you're validating. I understand why. Same for siblings, using skills, self-validation, validation of the sibling. All of that is helping with sustaining the ability to continue to ignore. It's very hard, right? Also, you can do self-reinforcement. Great job, me. Look at me, I'm being the boss of me, right? And all kind of cognitive restructuring. One of the cognitive restructuring that I always recommend, especially when there's an extinction burst, instead of saying in your mind, oh my God, it's getting worse, as you ignoring, you're saying, oh my God, it's getting worse. That means it's working. My ignoring is actually working. You see, you just change the way you think about it, and your ability to continue to sustain ignoring increased. And of course, do as much as possible reinforcement of practicing walking away, just like any other technique. Now, by the principle of dialectic, if you take something away, to be in a dialectical balance, otherwise it's not going to be effective, you need to put something right back. When we take attention away, we need to teach the sibling to put back positive attention to things that actually the super sensor may be doing that can be put attention to. For example, compliment your brothers or sisters' new sneakers, give them a bigger, pizza pie, slice. Tell them that, you want to play the game that they want to play, right? All of these are attention to the positive and giving to your sibling, meaning what? Sooner or later, the more you give, the healthier the relationship is going to be. Also, to decrease conflicts, we need to help our siblings understand that we ourselves need to decrease the vulnerabilities that we bring into the relationship. All of those fighting over whose pizza slice is bigger, whatever, all of that is putting more and more rupturing into the relationship, right? And when we're doing this giving, that decreases the conflicts over time. Teach conflict resolution. What do we do with conflict resolution? What usually happens, your kids come to you and say, Mom, Dad, my brother, my sister, waiting for what? For mom or dad step in and punish the other party. Now, orient, say, listen, I cannot control other people, including your brother or sister, right? When you drag me into the conflict, you're asking me to resolve your relationship problems. I can't do this. I am not part of your relationship. This is relationship between the two of you. You are the only people who can indeed resolve the problems in your relationship. Nobody else, because you're the one having that relationship. I can tell you what to do. I can practice with you to give you the capacity to do it. However, dragging me in is not going to solve any problems. It's going to only increase problems. So in the future, all we're going to do, I'm going to teach you what to do. I'm going to practice it with you. And when you're dragging me in, please expect me to ignore and walk away. Okay? So teach that if we want the other person to change, the last thing that we want to do is make them angry and defensive. And that's exactly what's happening. Instead, what we need to do, we need to use validation of the person, ignoring, positive attention. And then we do reinforce practice with both children and ignoring conflicts. And very importantly, after the conflict they will still continue to occur, especially at the very beginning. After the conflict, please process with your children what happened and what to do instead, and use that opportunity for reinforced practice. And always start with validation. I understand why you're so mad. I understand why you did that with your brother, because now what can we do differently next time? Come up with a solution, practice it in the moment, and reinforce that practice. Praise, attention, special rewards, points, whatever it is that you are doing. And of course, if the conflict becomes physical, Time out for both children. Doesn't really matter who started that. Cope ahead with high probability of problematic situations. So if you cope ahead, you're getting better capacity to predict. And when you have better capacity to predict, your sense of safety is happier, and therefore you'll be much more capable to use the knowledge that you have, because knowing what to do is necessary, not sufficient. You also need to have a capacity to do it, right? That comes from practice and understanding other and learning other things. But the other thing that gives you the capacity is coping ahead with it and having a plan in your head. So whenever there are any kind of high conflict situations that are coming up with the dysregulated sibling, help your child figure out what they can do in this moment if their dysregulated sibling indeed behaves in that manner, and practice it and reinforce it. And please do not expect that siblings will indeed do it. No attachment to outcome. All you're doing, all what you have seen so far is seeding, 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 seeding. You're modeling validation, you're offering opportunities for practice, you're teaching them, you're giving them skills and techniques. They don't want to do anything about it. No attachment to outcome. You still validate it. You showed them how to talk to other human beings. You asked them questions. You offered them opportunities to practice. You gave them information. You modeled. All of this wonderful. All of this goes, remember, parenting is strategic. All of that goes into the long-term change. Just keep seeding, keep orienting to the only thing you can do, controlling yourself. No attachment to outcome. Now, remember how we said that in order for us to have and maintain a healthy relationship with other people, we need to give. But in order for us to give to other people, we first need to give to ourselves. And we call it baking your own bread. Information field in which we exist, unfortunately, programs us to be takers. We are programmed to wait and rely on other people, reinforcing us, validating us, providing us comfort, support, love, me, 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 me. We don't teach our children how to self-validate, how to self-reinforce, how to be self-compassionate, how to self-reprogram, and so forth and so forth. And these on your screen are just several of the main ingredients of baking your own bread. Because you cannot validate, reinforce consistently and effectively other people if you don't first do it yourself. Be you a parent or a sibling, that you're asking all of that from the sibling, they need to first do it to themselves. We need to have something to give. I cannot, of course, teach you all of this, but let me give you just one. This is the most simple and straightforward. We don't teach our children even how to self-reinforce. And it's simple, not easy. Simple in the simplicity of it, but not easy because there are all kind of caveats to this. Self-reinforcement just means, great job, me. And that could be on anything. I got up in the morning, did not want to go to work, and I did, great job, me. I did not want to brush my teeth, and I brushed my teeth all the way. I studied for 5 hours for this exam, right? Great job, me, great job, me, great job, me. Now, the caveat to indeed consider here, great job, me, not on the outcome. Outcomes don't belong to us. We control nothing. There's infinite number of variables that need to happen just like that for any outcome to happen. I don't control reaching the bathroom. I don't. I produce an intention, but that's the only thing that's mine. I'm getting up, and as I'm getting up, a big meteor crashes on my house. What did I control? Nothing. I'm just a bunch of molecules. Nature allows me to reach the bathroom over and over again, but that's as far as it goes. I'm just one variable in the infinite number of variables that need to happen just like that for any outcome to happen. I'm a very important variable. If I don't produce the intention, I'm not going to get there, right? But this is something to really uphold. Outcomes we can only be happy or unhappy about. Even when we reinforce people or ourselves, God forbid, maybe, We reinforce on outcomes. Great job getting an A. No, that A doesn't belong to you. That's already an attachment to outcome, and it's programming your child that outcomes belong to us. And no, they don't. What belongs to us is a process. What I did. Challenge came my way. I faced it. I didn't run away from it. I did my best. I learned from that experience, and I did not get what I want. Can I self-reinforce? Absolutely. Great job me on facing, learning, doing my best. And I can also self-reinforce on being disappointed, not getting what I want, right? And a lot of the time we can do both, self-reinforce and self-validate. Teach your children how to self-reinforce. This is very important because we do not acknowledge our accomplishments. We don't acknowledge how much we're contributing, our process. What we do acknowledge is our mistakes, our errors, because we all have what's called negativity bias. Our sense of safety orients us immediately to something that's negative because it can be unsafe. Positive things are safe. Therefore, it takes effort to orient to that. Therefore, most of what we remember, stuff that happened to us that we don't like, and mistakes that we made. If that's most of what I remember, next time a challenge comes my way, of course I will run away from it, right? Because all I remember, no, I can't, no, I can't. Self-reinforcement forces you in a way, right, to acknowledge on a level of consciousness, yes, I can, yes, I can, yes, I can. And it's giving to yourself. You become less reliant on the reinforcement from the external world. Carve some time to spend with your child, right? Children are pre-programmed to ask for parental attention, right? Because of our sense of safety. This is something that is unsafe if parents are not paying attention to us, right? And if you want your child to follow your directions, you have to be prepared to pay for it, right? We need to have child-parent relationship bank. What our children are doing in terms of following your directions, being polite, these are not instincts. We sometimes treat them as instincts. My child should follow directions right away. My child should be polite. No, it's learned behaviors. And we need to pay for them from our relationship bank for the child. Child actually needs to want to do what we're asking them to do because they're motivated to make us happy, to please us, right? To make us proud of them. How do we do this? How do we build our relationship bank? Reciprocity, doing what the child wants on child terms. If child wants to play video games, sit down, play video games with the child. Wants to run around and play ball, go and run around and play ball. Also your validation, also your reinforcement, also you accepting your child's behavior as they are, your unconditional love to the child. All of that is building that relationship bank that you will be able to use when you actually need your child to do what you want them to do. Be that with their, super sensor sibling, be that with anybody else. And you're also teaching the child to build relationship banks with other people, including their siblings. DBT for children is not for children. This is a model. This is not about an age. And what we're doing there, we're helping parents and we're helping children to, number one, reprogram themselves. What we're doing, we're helping them understand what they're doing, the functions of their behavior, and what to do instead to override that function. But before that, we need to bring them to the level of consciousness, because 90% of our reactions, 90, come from unconscious processes. We do things without even realizing why we're doing that, right? So we need to catch those programs that are governing our behavior and they're maladaptive. We call them malware, like viruses, right? We need to catch them. We need to bring them level of consciousness so we can say hi to them, moment of mindfulness. And now we're getting a freedom of choice to override it and do something else. You cannot have freedom of choice if you don't know why you're doing what you're doing, right? So we're teaching self-reprogramming and we're helping parents to also reprogram their children. And that is not about age. That is, if you are 80 and your child is 60, you still need to know how to validate. You still need to know how to reinforce. You still need to know how to, make a relationship with your child that is healthy, right? So, and go away from harmful and traumatic invalidation, criticism, judgment, shaming, blaming. Unfortunately, we are all engaged in that a lot. Why? Because we were programmed by the information field in which we exist to teach our children how to be self-deprecating, how to be self-critical. We don't teach them how to be self-reinforcing. Okay, how many of you had parents who taught you how to self-reinforce? I'm not asking self-validation. Not asking. I'm not even asking how to connect to self-love. We teach how to connect to self-love as you are. No conditions, no requirements. We teach you how to be self-compassion. Who do you know that taught their children how to do this? We don't, because we ourselves were not taught to do that, right? So it's like transgenerational, right? So the answer to that question, it doesn't really matter. And what I'm telling to parents, for you to learn how to be a super parent, number one, you don't need to have a child who's emotionally dysregulated. Any child will benefit from super parenting. Doesn't really matter what age. Also, it will be helpful for you because we're teaching in that course self-reprogramming, right? How to improve your relationship with you. And I also highly advocate to people who are only thinking about having a child to learn how to be a super parent. For some reason, we all think that we're going to be wonderful parents. Why do we think so? Have you been parented wonderfully? A lot of the time people say, no, my parents made a lot of mistakes. Like, all right, then how would you know how to parent? And they say, oh, well, I will do everything opposite to what my parents did. I was like, well, number one, that's not possible because your parents programmed you. You already have that model in your mind. Number two, let's say you're superhuman and you can indeed go against your programming that you don't even know that exists, right? You will know what not to do. You will not know what to do instead, and will definitely not have a capacity to do it. So I highly, highly recommend everybody to learn to become a super parent, even if you don't have children yet, or you are 80 and your child is 60, doesn't really matter. It's going to be much more difficult. It's going to have a lot of obstacles to jump, and we need to still do it. Because if we can give that child at least one parent protector who is willing to learn what to do, who is willing to gain the capacity to do it, that child is going to have the protection that they need. Our sense of safety requires protection. We cannot live without that. And who else is to protect us? Our partners, right? Our friends, our children? No. Our parents are the only real protectors that we have. And we need that, because without that consistency, without that protective environment, without that stability, without that programming, our sense of safety is going to be clinically vulnerable. We will not be able, and that's why a lot of the time super sensors have so many, comorbid anxiety disorders, right? Because their sense of safety is out of the window. The environment is not providing with the protection that they need. And on top of that, they cannot control the only thing they can themselves, but nobody's teaching them how. Oh, Carol, this is the dialectic. This is the two parallel sides. We are working for those outcomes and we're not attached to them. That is the paradox that we're entering in each and every day. We're not realizing that. And understanding it this way is very important, because otherwise we are seeing things one-sidedly as mutually exclusive. Working for outcomes and not being attached to them, it's parallel. You see, it's not mutually exclusive, and being effective necessitates us entering into a paradox every single day. So ignoring is a very big question for all the parents. Every time I do trainings with clinicians or parents, ignoring. Now, number one, ignoring is based on your child learning what to do instead. If you just ignore, it's not going to do anything. Number one, when you take something away, it's one-sided. You need to plug something back in. And you're plugging that something in is your modeling of behaviors that you want your child to do, not modeling behaviors you don't want your child to do. And teaching your child and doing reinforced practice with your child each and every single day. Now, with that foundation, coupled with validation, You see what I'm talking about? I'm talking about parenting in between, because ignoring is already the result of the parenting, right? Coupled with validation, coupled with you having and working as much as possible on increasing your parent-child relationship bank. So your child is more motivated to actually please you as opposed to make you miserable and harm you, right? So all of that parenting is happening in between. So when you do need to ignore, it already decreases chances that the child is going to want to, you know, destroy something or harm you, right? Or do something else to something to other people. But still things happen, especially at the very beginning. Absolutely. So what we want with ignoring, when we talk about ignoring, is always planned ignoring. So you're ignoring the maladaptive behavior, and as soon as child stopped screaming just to breathe, you're attending and saying, great job calming down. You will not have enough time to say that, because as soon as you're attending, the child will start screaming again. So it looks like great job, back and forth, back and forth. With time, child learns you want the mom's attention, dad's attention. You need to be calm. You need to be calm. You need to be calm. So you want to stay in a situation as much as possible to be able to do this back and forth dance. Now, nothing too extreme. There are times when you would walk away when you're ignoring. Number one, when there's a very high probability that your child is going to turn aggressive, physically aggressive, walk away. Number two, if you yourself feel that you're about to spontaneously combust because you cannot take it anymore, it's much better for you to walk away and not have an adult temper tantrum than for you to stay and do this back and forth, right? Also, if you're afraid, if you have a child who is extremely volatile and who is destroying a lot of property, you know what? Go ahead. There are families with whom I work that remove all of their valuables from their house in the process of this ignoring and changing, because therapy is, in a way, doing what? It destroys established dynamics. Nobody likes it. Nobody likes those dynamics, but everybody's comfortable in the predictability of them, right? And we're destroying all of that. Nobody likes it. So it will get worse before it gets better. So if your child is very, very, very likely to be destructive, remove all of your valuables. Put it in a storage, give it to your mother-in-law, I don't know, whatever. So that you don't have to be put in a position to decide between my valuable and reinforcing my child, extinction burst with attention. Because if I do that, oh my God, I just made it worse. I shouldn't even start to ignore, because if I start to ignore and then I reinforce it, escalation, I just made it worse, right? You don't want to be put in that position. And select as priority the valuables, right? Because then it's valuables at the expense of your child doing better. Sometimes you do walk away. Remember orientation? You oriented your child and you said exactly that. The most caring thing I can do for you in that moment is patiently wait. Your child knows what you were doing. Your child understands that they're not being abandoned. Your child gets it. And you're teaching your child to do that to their peers and to their siblings whenever they're being provoked, right? So they understand what it's all about. They can throw all kind of accusations at you and say that you're a bad parent, bad mother, bad father, you abandoned me. Like, they know what's going on. All right. But that's why, but you first need to orient. And you may need to orient over and over and over again. That's not a problem. Just don't do it right before or during the temper tantrum. During the temper tantrum, I don't see you. There was a question what 3 monkeys are. That's 3 monkeys of ignoring that we teach to children. I don't see you. I don't hear you. I don't talk to you. Remember the 3 monkeys, see no evil, hear no evil, right? Do no evil, right? That's what we do. I'm completely out. And even though you don't like it, nobody likes it. I am doing this with the function of getting attention or instrumental function of getting something out of you, and you're not giving me anything? That's painful. Nobody likes it. And again, paradox, two things coexisting at the same time. You don't like it, and it's the most caring thing I can do for you. And I am indeed patiently waiting. Reprogramming works for anything. The thing is that not be attached to the outcome of when is going to happen, in which fashion is going to happen, meaning how much time it's going to take and what will be involved in it. If, when, that's when it's if, I really hope that all of you will learn how to teach a child to give to themselves. When we reprogramming through the mean of helping the child bake their own bread, resentment means what? What my sibling did affected me personally. One of the main things that we're doing with reprogramming, we're helping our children understand, and we're learning it ourselves. Two sides to the existence, right? And always, whatever you're touching, one side is going to be stable, another side is going to be flexible, right? So, for example, parenting. I love you unconditionally. I accept everything that you do through validation. And by definition of acceptance, I don't like what you're doing, right? If I need to accept, I don't like it, right? So, but I'm validating it. I'm not criticizing it. And then no wiggle room. If it's 50 minutes on computers, it's 50, not 51. And I take in information. I am making decisions flexibly with new information coming in. I'm changing my decision, taking perspective of my child, right? Decision making. I know exactly what I want, my goal. I have my means to my goal, and I'm flexible in applying my, and I'm skillful in applying my means to my goal, and no attachment to outcome, right? The same is two types of the relationship. My relationship with me, fully unconditional. I just am an entity, neither good nor bad. An entity of human beings. When human being is born, is he good or bad? Neither. Is sun good for giving me light and bad for burning my skin? No. Sun is sun, and it can burn my skin, give me heat. Two sides. I just am, neither good nor bad. Neither. That's how I get peace. If I say good, I can also be bad. No peace. And that's the synthesis. I fail, I succeed. I make a mistake, I gain mastery. People like me, people don't. I'm happy, I'm disappointed. It's an end. What happens with resentfulness is my relationship with me got affected by my relationship with another human being. What we do, we don't live in this dialectical balance. We make our relationship with ourselves conditional. We move it from unconditional information field in which we exist, programs us to think that our relationship with self is conditional on how well we fare in life and what other people think about us. I succeed, I'm good. I fail, I'm bad. People like me, I'm good. People don't, I'm bad. Good, bad, good all day long, sometimes on a daily basis. This is such suffering. What we need to learn is that no, my relationship with me is fully unconditional and is not dependent on my relationship with other people and what other people think and what I do and how well I fare in life. However, my relationship with other people is conditional on my relationship with me. If I am critical to me, I'll be critical to other people. If I have pain, I'll share pain. I have happiness, I'll share happiness. I will share what I have. I cannot share what I don't have, right? So that's the dialectic of it. So resentfulness means that somebody hurt me, my relationship with me, and they need to heal their relationship with self. They need to give to themselves enough to be able to indeed and learn how to make that relationship with self as unconditional and maintain the stability of it. Learning how to sit with self-love, learning how to indeed see yourself as neither good nor bad, catching the malware. We call them also monsters under the bed, not real things, but we suffer from them, right? Catching those things that indeed link my relationship with self, my relationship with the external environment, and saying, hey, no, you're just a monster under the bed, you're not real. Doing all of that, healing the relationship with self, of course, is going to heal the relationship with another person, regardless of how bad the relationship was in the past. Because resentfulness means I'm so miserable, I don't have enough to give.